Hello, Mr. Ramirez. My name is Brenda Ramirez. I'm a family nurse practitioner student, and I'm here to to do your abdominal assessment. Before I begin, can you just state your full name and date of birth?
Felipe Ramirez, 1 May 1989.
Okay, so I'm going to be doing an abdominal assessment on you. Do I have consent from you in order to record it so my professor can grade me?
Yes.
Okay, so I'm going to be doing an abdominal assessment on Mr. Ramirez, and I'm just going to, I started off by having him use the restroom so that his bladder is emptied and it doesn't alter alter my assessment. I also have him laying comfortably. I have his head propped on a pillow and his legs also propped up so that it can relax his abdominal muscles. Looking at his overall skin color, I'm making sure that he doesn't have any signs of jaundice, any yellowing. I'm looking at the sclera to make sure he doesn't have any signs of yellowing. I'm looking at his nail beds as well and his overall color, make sure that it's appropriate for his ethnic background. I'm making sure that he doesn't have any striae, any discoloration, any rashes, scars that I might notice. I'm looking at his overall skin and any excessive hair growth. I'm also going to look at I'm going to look for any distension, and his stomach's flat, but if sometimes I want to check if there's any mass, especially you want to check for bulging around the liver and the spleen area. You're assessing the contour of the abdomen. And you also want to assess to see if you see the aorta pulsating, which I don't see that. You might be able to see peristalsis on a really thin person, but I don't notice that. But that would be considered a normal finding. So you want to look for any bulging. You want to assess for. You want to look to see if the patient, if the belly is protruding, or any scaphoid or hollowing of the belly, and you want to pay close attention to those scars so that you can get maybe more input on the patient's history. Maybe if they have a scar on the right lower quadrant, you can ask the patient. Maybe they say they had appendectomy. So you'd be able to get more information on them. Or if they have a birthmark on there, you also want to look at that, whether it grew before or not. Just have a good documentation over that. So now that I did an overall view of his abdomen, make sure that he doesn't have any distension. You could also look, while you're viewing, you can look at femoral arteries at the clinic if you want, or once you get to auscultate, then you can do that as well. So now I'm going to start with auscultating. You want to auscultate before you palpate so that palpation doesn't alter the findings, like increasing bowel sounds, and alter your findings on your assessment. So I'm going to auscultate. I'm listening for a normal active bowel sounds, which is 5 to 35. You're going to hear gurglings, clicks. You should hear 5 to 35 within a minute. If you believe that they're hyperactive or hypoactive, like they're more frequent or less frequent, then you want to listen for a good 3 to 5 minutes so that you can make sure you're getting a full overview of real auscultation before you make that diagnosis. So I'm going to start off with auscultating, and once I'm done, once I auscultate, I'm going to actually, I'm going to use the belly button as the midpoint, and then you're going to create a line of 4 lines. Just create squares. You're going to do the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Once I'm done listening, I'm also listening to see if the liver, if I hear any liver friction rubs or any spleen yeah, any friction rubs on the spleen. I'm also, once I'm done, I'm gonna listen to the arteries to make sure there's no bruits or murmurs that are transpired. So let me start by auscultating, and I would do this for a full minute. I start at the right lower quadrant, right where your appendix is. I'm going up towards where the liver is at. I don't hear any friction rub, normal active bowel sounds. I would do it for a full minute. Left upper quadrant near the spleen. And then sometimes you might notice while you're placing your stethoscope, there's a bulge right there for someone who's been constipated or has fecal impaction for a while, or they might feel some pressure there. And you listen for a full minute. Now that I'm done, I'm gonna go down to the epigastric area, and I'm listening with both the diaphragm and the bell for bruits or transmitting murmurs. Which I don't hear none. Now I'm gonna go to the renal arteries. And I'm doing this with the diaphragm and the bell. Renal arteries are just right lateral to the aorta. Next, I didn't hear any bruits or transmitting murmurs. I'm gonna listen to the femoral. In the clinic, you would listen. You would actually have. You would place your stethoscope along the skin. No clothing, because it would mess up the hearing or give you. You might think it's a bruit or a murmur. I'm gonna listen, and I'm just listening to his femoral arteries along the sides. I don't hear any bruits or murmurs, and I didn't hear any friction rub along the liver or the spleen, and normal active bowel sounds. Next, I'm going to start with percussing, and I'm going to do all quadrants. They should be tympanic, and then once you get to the liver, it should be dual, as well as the spleen, and you can. So I'm going to be percussing. The bladder should be tympanic unless it's distended, and that's why I had him go to the bathroom prior to my assessment. So I'm going to just start. I also want to, while I'm percussing, I'm also going to look at Mr. Ramirez to see if he has any signs of grimacing or any kinds of pains, any signs of pain like his facial expression. And I hear, and right there, I started hearing dull. So that's the liver, and now I'm going to do the liver span now that I'm here. So I'm going to start at the mid-clavicular line near the nipple. And I'm listening for, I'm going down, and it's resonant. Right there. So, so now I'm going to measure this. It should be between 6 to 12 centimeters, the liver span. And his is 7 centimeters. And it's about 1 centimeter below the right costal margin. I hear tympany on all borders. Sometimes you might hear scattered dullness if it's someone who has fecal impaction. And then I'm going to also percuss gallbladder. Tympanic. And then now I'm going to assess the spleen. I'm going to percuss at the 10th intercostal space. It could be anywhere between the 9th and the 11th rib. So we know the last one is the 12th. So I just work my way up. And I'm just going to, and I'm going to have him take a deep breath. And so it's dual, prior, and tympani once he takes a deep breath. Now that I'm done with percussing, I'm gonna start palpating. I'm gonna start with light palpation, and then while I'm doing this, I'm gonna be assessing him to see if he has any signs of pain, if he's refraining from that side, or he starts he starts moving away from the palpitation, or he grimaces. Mr. Ramirez, let me know if you feel any pain on light palpation, so you just want to lightly palpate. And while I'm palpating, I'm also looking to see if there's any masses. And I'm just palpating. I could feel the liver on light palpation, 1 centimeter below right costal margin. So again, any pain?
No pain.
Okay. There's no signs of him showing discomfort. And now you can go deeper palpation. You want to use both your hands and just palpate, and just have an idea of where those landmarks are, where the appendix is, where the liver is at. So right here you can feel I could feel the liver. And Mr. Ramirez, can you actually take a deep breath for me? And you could feel the liver right there. And then I would do it also on this side for spleen. And you should not feel a spleen tap. You should only feel that liver tap, but not the spleen. Mr. Ramirez, take a deep breath. I do not feel the spleen. I don't feel any distension. Some people who are constipated will grimace when deeply palpating. I did not feel any masses. I did feel the liver about 1 centimeter below the right costal margin. And you can also assess for Murphy's sign when you're doing this, so you can grip. And then I'm gonna have him take a deep breath. While I'm having him take a deep breath and I'm palpating in, if he were to stop his breathing and it causes pain, that would be a positive Murphy sign. So Mr. Ramirez, take a deep breath. And he was able, so it would be negative Murphy sign. Next, I'm gonna do McBurney sign. So what I'm gonna do is I'm gonna look for the superior iliac, the anterior superior iliac spine, and then I'm gonna locate the umbilicus, and right 2/3, right there, you're gonna deeply palpate and see if he has pain. This would this is a sign for appendicitis. So I'm gonna push pressure. And if he had pain, that would be a positive McBurney sign. The Murphy sign, that would be a sign for inflammation of the gallbladder, like cholecystitis, or some type of liver inflammation of the liver, like hepatomegaly. So that would be deep palpation. And next, you want to assess for the fluid wave test. So what you want to do is you have someone, if you, as you can tell, he doesn't have ascites, but if you thought someone had ascites or they had excessive fluid, what you want to do is you have the patient kind of place their hand, it might work if you go this way. Would that work? Like right there, yeah. And then what you're gonna do is, I'm gonna just kind of tap, and then if he had fluid, that fluid's gonna come and tap my other hand. So it'll be like a tap. So you just slightly tap, and if he had ascites, that fluid will shift to this side. And then and there was no tapping, but if someone had ascites, that would be a sign. Next, I'm gonna assess for costovertebral tenderness, the CVA tenderness right in the back. So Mr. Ramirez, I'm gonna have you sit up, and you're gonna sit up towards me. You're gonna face this way so that she can see the back, which way I'm looking. No, I just need you to sit up. So the CVA, I'm gonna be assessing for, I'm gonna see if he has any tenderness, and I'm gonna locate his kidneys, so I just need you to turn so that she can see. You're gonna locate the 12th rib, and you know that the right kidney is a little bit lower, so you're, so what I'm gonna do is, let's see, you just locate that 12th rib. Should be right there, and then I'm just gonna percuss, and if he had pain, that would be positive for CVA tenderness. Any pain?
No
Yeah,
pain.
he did not have any pain. So this would be my abdominal assessment, and that concludes my assessment.